Welcome everyone to HealthSource RI for Employers monthly webinar. Today our topic is going to be about Medicare for employers. My name is Frances Fiat. I'm the sales manager for HealthSource RI for Employers, and later in the presentation I will give you some contact information. So I welcome everyone who's logged in today. Just a couple of quick reminders. I know some people have logged in previously. We ask that everyone keep their phones on mute so that we don't hear any background noises. We do have a question period at the end, but we also have a chat line open that you can send questions to us that we can address at the end. We are on Twitter. It's hashtag HSRI for employers. Feel free to go through that as well. So let's get started. Just a refresher for everyone about who we are, and if there are new brokers in the audience too, we'll discuss how you can be credentialed at the end. We're the exclusive source for small employers to offer a multi-carrier option of looking at various carriers across the different meta levels, both for medical and dental. Employers can customize the plan for their clients, and there's no participation requirements. Business owners can set a defined contribution to control their health care and dental budget. Employees get to choose the plan that works for them. We also offer ancillary products for employers with life, long-term disability, vision, medical bridge, critical illness, and accident. And it just helps employers have the peace of mind that they're offering their employees the various products that they need. Also, we work with brokers, and as I begin to talk about Medicare, there are brokers who are certified for Medicare who can absolutely assist employers and employees, and we work on a day-to-day basis with brokers. If you need additional contact for the business engagement team at HealthSource RI, our website is healthsourceri, all one word, .com/employers. And our customer service line is open Monday through Friday, 8:30 to 5 p.m. at 855-683-6757. We have customer service reps who are on the phones all day long, so you will speak with a human being. Okay, so sometimes both employers and employees, there's always questions regarding Medicare. Eligibility for Medicare is at the age of 65. It is different than Social Security. Social Security eligibility is based upon the year that you were born, and so it is not at 65 for everyone, whereas Medicare continues to be everyone is eligible at age 65. Medicare coverage is for that individual who's 65. It does not cover family members. The Center for Medicare mails out a letter to employees, to individuals, 3 months before they're going to turn 65. That's called their initial open enrollment period. So they do send the letter to explain how it works and what they need to do. And some people are at their retirement age already, and at 65 they get Medicare. Some people may still be working. In addition, individuals under 65 with disabilities can also qualify for Medicare. It's a different process for them versus the retirees. There are 4 parts to Medicare. So you'll hear these letters used a great deal. Part A is hospital coverage. Part B is the provider coverage. So under provider would also come diagnostic testing, lab work, those types of services. Part D is the prescription drug coverage, and Part C is Medicare Advantage plans that you get through private carriers. Part A and B together is what people refer to as original Medicare. A brief review of the parts. So Part A covers hospitalization, so inpatient care, which could be at a hospital, a skilled nursing facility for rehab, and in some limited circumstances, there can be some things for home. The current deductible, if you take Part A as it is $1,316 per hospital stay. That is if you just have Part A alone. There are a bunch of variables that a broker could go over with you, but that's just the starting point with what the government offers. The individual becomes eligible for Part A during their initial enrollment period, which is known as IEP. This, like we said, they notify you 3 months before you're going to turn 65. So that open enrollment is 3 months before, the month in which the person turns 65, and then the 3 months following is when that's that initial period of where they have to communicate with the Center for Medicare. Part A is free for those who have worked at least 40 quarters. So meaning there's not going to be any premium associated with Part A once you take it. Others that have do not have 40 quarters of work history can still get Part A, but there would be a premium. That premium varies. So as long as you have a work history of the 40 quarters, you get Part A and no premium. Part B, which is the provider coverage, covers outpatient care, as I explained before, such as office visits, seeing specialists, diagnostic tests, durable medical equipment, ambulance services, all of those day-to-day things that people need access for taking care of their health care. Under their coverage, that coverage coming from original Medicare from the government, currently it is a deductible of $166, and then there is a co-insurance split of 80-20. These amounts that I'm giving are currently in 2018, and there could be changes for 2019. Part B has a premium associated to it, which is based upon income. So it's not as free as people say for Part A. And when someone reaches out to the Center for Medicare and they're deciding to sign up for A and then B, they would provide to them what that premium is going to be because they look at your income. If an individual is already retired and taking Social Security, the government will pull that amount out of their Social Security check when they sign up. If they're not currently taking Social Security, because as I explained earlier, Social Security is now based upon the year that you were born, so not everyone, it's not an automatic that everyone's getting that at 65. It can be 66 and older. Some people also delay taking Social Security because there's a benefit to that. So some people delay it. They're still working and they delay it. They could delay it until maybe they're 70. So if they do decide to sign up for Medicare, the government would bill them individually for their amount, and they bill it quarterly. Individuals can choose to opt out of Part B, and they can do this by showing that they have creditable coverage. If an individual decides to enroll in Part B at a later date, that is fine. The individual just always has to show that they had creditable coverage during the period that they didn't have it, and at a later date they can sign up for Part B. If they did not let the government know why they were not signing up for Part B and they can't show that creditable coverage, there is a late enrollment penalty, and it's called the LEP. However, as I explained, you can avoid that by, when your initial open enrollment period is, signing up for Part B and getting that going, or if you have health insurance through an employer or a spouse, you would just let the government know that, and at a later date you would always be able to show you had creditable coverage. Part D is coverage for prescription drugs. It could be a standalone prescription drug plan. These are called PDPs. The government can give you a list of vendors that you can go to for medication, or what some people will do is they'll pursue the Medicare Advantage plan, which is the Part C, with a private insurer, because many of those plans are coming with the prescription drug built into the supplement. You must be enrolled in Part A and or B to enroll in the Part D. There's also a late enrollment penalty penalty for D as well. If during your initial open enrollment there's no communication on why you're waiving D, if you have creditable coverage and you already have prescription drug coverage, it's okay, but there's a situation as Part B. So if for a continuous period of 63 days you didn't have it, there will be a penalty when you need to get prescription drug coverage down the road. How can the penalty be avoided? If similar to the Part B, you know, if someone is currently on an employer plan or on a spouse's employer plan, the retiree has coverage through the Veterans Administration, or they're doing the extra help the extra help with costs that comes from the Center for Medicare, could be reasons why someone is not enrolled in that Part D. And the last part, which is Medicare Advantage, is the Part C, which people have heard about. It refers to the Medicare Advantage program where Medicare beneficiaries who are wanting to enroll can enroll in a private health plan, such as a health maintenance organization or a preferred provider type of plan, and receive all of their Medicare coverage for Part A and B and also D, where it gets all wrapped together, and you have an insurance carrier such as Blue Cross who would be the person that would oversee your plan. And sometimes these plans that the insurance carriers are offering, these supplements, also fill in some of the gaps for original Medicare. As I explained in the beginning, original Medicare Part A for hospitals comes with a $1,316 deductible currently, and so some of these supplements will close that. They won't have that deductible. They'll close that down and actually have a much lower copay that you would pay when you went to the hospital. They do the same for Part B too. You wouldn't necessarily have the provider deductible of $166. They sort of fill in the gaps where they lower that and they go to more copays. So that is why some people are very interested in finding these supplements. In addition, with filling gaps, some Medicare supplements will even offer dental coverage built in, vision, and some other things that people over 65 can be looking for. Enrollment in Medicare Advantage plans has grown over time, with over 19 million beneficiaries today enrolling in Medicare Advantage plans with private insurance carriers. So that means about 33% of Medicare beneficiaries. These plans do have a monthly premium, and there's different plan designs, so depending on which one is chosen, there can be a variance in that price. Let's kind of review. At Health Source RI for Employers, we are always working with employers that have 50 employees or less. So it's the small group market is what we're talking about. So I'm talking about small group employers here. An employee, when they're ready, you know, if an employee is still working at 65, they can waive, they would let the government know they're going to take A, but they're going to waive Part B and D because they're still working. And they have access to credible coverage at their employer. So they can continue to do that if they want to do that. There are Medicare certified brokers that can review the components of both group and individual Medicare options with employers and employees. There are many that work with us that are certified. Employers can pay for group Medicare supplements. So if an employee decides they're going to make that move to Medicare and they can do a group Medicare supplement, because there are group Medicare supplements and then there's individual, the employers can pay for the group Medicare supplement similar to how they pay for coverage under the small group employer plans. Costs for these supplements oftentimes are much lower than what the small group rates are. Medicare coverage, these plans that are being developed are typically designed to benefit the enrollee over 65. For the small group market, and once again, I'm talking about employees with less than 50 employees, if the employee moves to a Medicare supplement, that employee actually comes off of the small group's employer group census. So they would have their own plan. The bill can be sent to the company for the group Medicare supplement, and the employer would pay that for that employee. One thing to just keep in mind about employers, employees with less than 20 employees the setup is a little bit different when a company is 20 to 50. For companies with less than 20 employees, Medicare is always deemed as the primary payer, and whatever else insurance they have is secondary. So it is important when you have employees working for a company with less than 20, and there are there are quite a few companies out there where they do have less than 20, is that they should have both their Medicare card and whatever other insurance card they have that's working together. Employers who have more than 20 employees, Medicare is considered secondary payer, and whatever other insurance you have is your primary. During initial open enrollment for an employee, the employee would obtain their Medicare card from the Center for Medicare at that time. The card denotes A and B, so if they decide to waive B, it wouldn't have a date. So it denotes, you know, you've got A on this date, and if you do take B, it denotes what date that you picked it up. So employees who are 65, you know, who are going to be eventually the Medicare recipient, the employee has options too. When it comes to coverage, all employees turning 65 would go obtain their Medicare card, and they would notify CMS as to whether they're signing up for B and D or not. Employees can keep their insurance under their employer plan as is, stay part of the census, be still part of the same renewal process, or they can make a transition into the Medicare piece of it, and they can definitely work with a broker to make sure that they're meeting the requirements that needs to be done for the Center for Medicare. Employees can obtain a group Medicare supplement from which the employer would help them with the broker through private insurance companies. And once again, as I said, that means they come off that small group employer plan. They have their own separate supplement, but the employer is paying for it. The supplement would handle A, B, and D, as well as some additional items. And there are definitely products out there with the different carriers that brokers are quite familiar with. The employee does have to sign up for Part B, no matter if they pursue supplements, and no matter which supplement they take, they do have to have Part B, and that Part B does come with a premium, so they would get a bill for that premium if they're not already taking Social Security. Just one item to note: when if an employee, qualifies, is eligible, everything's been looked into, they're 65 and they're going to make the move to Medicare, dependents cannot go with them. So a person who's 65 could have a spouse that's younger than them. They could also have kids in college that are still on their plan, since children can be on parents' plans till they're 26. So dependents cannot go with them. But if a company has more than 20 employees, that company qualifies for COBRA. And one of the items in COBRA is any dependents who may be in a transition period because the lead employee is going to move to Medicare. Those dependents can stay on that same plan under that company for up to 36 months. It's a qualifying item for COBRA is coverage because someone has moved to Medicare. So they can stay on that plan through that company. Those dependents would stay on that company's census for up to 36 months, which is 3 years, that gives people a good transition time. Employees with less than 20 employees do not have the same guidelines. Companies with less than 20 employees are under the Rhode Island State Continuation, also known as Extended Benefits Program, and there isn't a guideline around Medicare. So if this employee still wants to pursue it, that spouse or dependent could pursue the individual and family side of health insurance, and there is a whole entity side to that for HealthSource RI. It gives them the opportunity to compare plans and also see if they qualify for the annual premium tax credit. Just a review for everyone about contact information, as I explained at the beginning. So my name is Frances Theot. I'm the sales manager for HealthSource RI for Employers. If you wanted to reach me for any reason, my direct line is 401-236-8009. And my email is Frances. My last name is THUOTTE@nfphealth.com. If you're a broker who is not credentialed with HealthSource RI right now and you want to become involved with this good model for employers, you would reach out to Jocelyn Harguitini, who is our broker relations person here for credentialing and making sure everything is working for you, and really assist with us getting our business engagement team to work with the brokers and their accounts. And Jocelyn's direct line is 1-857-499-2068. Her email is also on the screen. So we just want to let you know that we always want your feedback. Please give us suggestions for future webinars, get back to us with questions, and just want to let everyone know that our next webinar will be Thursday, October 18th. We always do the webinars on the third Thursday, so it will be Thursday, October 18th at noon. And the topic will be 2019. Not only will we be overviewing about changes for health plans, but also we'll talk if there's any changes for dental, what's going on with ancillary, rate changes, all of that new information of what's coming up for 2019 will be reviewed at our next webinar. We hope that you'll join us. So I want to thank all of you for joining us today, and we look forward to having you on our next one. I did not receive any items in the chat line. I can just give a minute here if anyone has a question. If you want to take yourself off mute, give us a question. I do not have anything in the chat line. So it looks like if you think of any questions later, feel free to email or give us a call if you need any additional information. Thanks very much for joining.